afternoon, everyone. Thank you for joining us today. Before we begin today, I would want you all to take a moment and think of the last time someone told you that period pain or any kind of pain is normal. Just deal with it. So, for so many of us women, this sentence has become a staple script that normalizes pain, and in return delays diagnosis and often hides the silent struggle of endometriosis. And that's why this session is so important. At Aarsh ReproHealth, our mission has always been simple yet powerful to create a space where reproductive health is understood, supported, and demystified. A space that blends expert science with compassionate care, a space where no question is too small and no concern is dismissed. Endometriosis affects millions, and yet so many continue to navigate it with confusion, fear, and sheer silence. Whether you are here because you are experiencing symptoms, supporting someone you love, or simply speaking clarity, today's conversation is made for you. We're here to break myths, decode symptoms, understand the science behind, and most importantly, remind you that you are not alone and hope and help are always available. Before we proceed, I would like to introduce our guest speaker for today's webinar. To guide us through this, we're truly honored to have with us Dr. Poornima, a renowned fertility expert and the medical director of Mom IVF and Research Center, Hyderabad. Dr. Poornima brings over 11 years of experience in reproductive medicine, and her journey has nothing been short of inspiring. She trained at the prestigious Monash IVF in Australia, worked extensively in advanced fertility care, and co founded MOM IVF with a beautiful mission to make world class fertility treatments affordable, accessible, and deeply compassionate. She specializes in endometriosis, evaluation of infertile couples, 3D ultrasonography, IUI, IVF, and ICSI procedures, operative and diagnostic laparoscopy and hysteroscopy, and psychosexual counseling. What sets her apart is not just expertise, but her empathy, the way she listens, supports, and walks every step with her patients. We could have not asked for a more experienced and more compassionate voice to help us understand endometriosis from the lens of symptoms, signs, and support. So, without a further ado, let's dive into today's topic, demystifying endometriosis, a conversation that promises clarity, comfort, and a lot of learning. Ladies and gentlemen, please join me in warmly welcoming Dr. Poornima.
Thank you, Nisha, for the kind introduction. On this outside, I would like to thank Aarsh ReproHealth and Preetham for having me here today for a very important topic, demystifying endometriosis, which has definitely increased in incidence nowadays. I'm doing my fertility practice for the past 12 to 13 years. 10 years back, I have not seen this much increase in the incidence of endometriosis, but now there's around 10% of the infertile couples are suffering with endometriosis. So let's not waste the time. I'm going to share my slides. Again, I welcome you all for today's webinar of very important topic of demystifying endometriosis. Today, we are going to discuss about what are the signs, symptoms, signs behind endometriosis, how we can manage. We are not going to go into the treatment aspect, which we are going to cover in the next webinar, but how to identify endometriosis. As Nisha rightly said in the introduction, a lot of people think that it's a bad period. Just I had a lot of people ignore the pain during the periods. If you discuss with some of your peers or your parents or even with your teachers or your colleagues, they just said it's a bad period, you have to deal with it. But are you really dealing with a bad period, or it's beyond that, or you're missing something? So that's something which we need to all look into. So what is endometriosis? why it is such a big deal if you have endometriosis. See, basically, you all know the structure of a female reproductive system. Like you have the uterus, vagina, and you have fallopian tubes and two ovaries. Generally, every month, a normal woman bleeds regularly. It will be a 28 days menstrual cycle. And once the bleed happens, when the endometrium, the inner lining of the uterus is called endometrium, where where the baby comes get implanted, and it's the same endometrium which sheds during your menstrual cycles. So what this happens when the endometrium sheds, it comes out through the vagina. But in endometriosis, see, one important thing with endometriosis is a lot of people ask me why, but there is no answer to that why. There are only theories which explains why it happens, but there is no exact reason till date in the literature. After this much of research on endometriosis, there is no exact cause or root cause that this is why endometriosis is there in that woman. There is no as such cause why, but there are theories which support or which can say why these patients are more prone to endometriosis. So basically, endometriosis is a complex inflammatory disease. Basically, it's an inflammation in the body in which, as I told you, in every month the menstrual cycle, endometrium shuts and comes out of the vagina. But here, the endometrial tissue not only grows on the inner lining of the uterus, as I said, which is called endometrium, instead of coming out of the vagina, sometimes it goes back and grows outside the endometrium as well. And the most common site is the ovaries. The most common site is it's very accessible, right? The ovaries are that it goes through the fallopian tube and settle in the ovaries. And there are other sites also where this endometrial tissue can grow apart from the ovary and the pelvic region. It is seen in fact, it is surprising to see endometrial tissue in bowel, bladder. At least bowel and bladder are very near to the uterus. These organs are very nearby, but we have there are case studies which have seen that endometriosis is there in the brain also, lungs, and muscle. So basically there are so many case studies which have been reported. So it's a very complex inflammatory disease which has to be dealt with, and it has to be diagnosed early so that we can reduce the symptoms of the patient. So basically, as we have discussed, the tissue during the menstrual cycle, this tissue which has been outside the uterus or outside the peritoneum, that is outside the uterus, behaves same like the uterine lining. How endometrium behaves, like when it bleeds or when the period comes, so it becomes thick and dry. See, wherever there is blood involved, there is inflammation, there is thickening, there is drying, breaking down, and there is adhesion formation. See, if you get a cut, how it heals after the blood. So it heals with a scar. The same thing happens outside the uterus. So there is a drying, thickening, breaking down, and there is a scar formation. And because once there is a scar, there is a very high chance of adjacent organs to come and get attached to it. So so that's the main reason why endometriosis is, because sometimes when the bowel or the bladder or your intestines or your urinary bladder gets involved, then there is a risk of obstructions and all. So uh, so as this tissue during the menstrual cycle behaves like the uterine lining, thickens, dries, and breaks down, while the uterine lining has an exit via the vaginal canal, but the one which is on the outside has no way to exit the body and sprays the nearby organs like ovaries. The most common site is the ovary. We see almost 60 to 70% of the cases we see in the ovaries, fallopian tubes, and the nearby organs where in the before the uterus we have the urinary bladder, and behind we have the intestines, the mostly rectum. So these are the most common sites endometriosis spread to, causing pain. The most common symptom, I've seen patients getting and coming to ER, getting admitted because of severe dysmenorrhea. So many in our night duties, we used to at least get weekly twice a patient getting admitted with severe dysmenorrhea in the emergency. So there is a terrible pain and inflammation. As I told you, wherever there is a healing, scarring, there is a clogging and adhesion formation. There is a there will be organs which become adherent to each other. So basically, as I mentioned earlier, endometriosis is a constant, it's a chronic inflammatory disease. Like any chronic inflammatory disease, so like it needs a lifetime management. It can't be cured, it can be managed till that woman is getting her means. Even after menopause also we have seen some cases of endometriosis. Comparatively, the incidence is slightly less in the menopausal age group, but still we see cases even in the menopause as well. But the diagnosis is pretty less common in menopausal age group. But still, as I told you, once you have endometriosis, it can't be cured, it can be only managed. So it's very important to understand this fact. And it occurs in 6 to 10, as I told you. 10% of the women or walking into our fertility clinics are suffering with this condition. And especially when you look at the infertile women, the statistics might vary. In infertile women it goes to as high as 38% also in some studies. And if a woman is complaining of chronic pelvic pain, that means severe intolerable pain during periods, severe dysmenorrhea, then 71 to 87% of the women might be suffering with endometriosis. You should always have that suspicion back of your mind. So the most common age is 30 to 40 years, but now we are not having this age bracket. We are seeing endometriosis in young women as well. As early as 18 to 20 years also patients are coming with this endometriosis. But according to the statistics, the most common age is a reproductive age group around 30 to 40 years. And family history, if the woman is having a strong family history in the first degree relative, it is 7 times greater in this woman comparative to the no family history. And early menarche, whoever is getting nowadays, kids are getting very early menarche. Apart from the endometriosis aspect, I want to bring into the notice that children are getting their first period as early as 8 years, 7 years, 9 years. Previously the age of menarche used to be around 13, 14 years. That should used to be the 12 to 14 years should be the used to be the ideal age. But nowadays we're getting very early menarche in girls, young girls. If when we look into the statistics or the reason for this, there are so many endocrine disruptor chemicals in and around us. Now we are living in a world which is full of pollution, endocrine disruptor hormones. If you look at it now, there is a very high incidence of cancers. Previously we never used to have that much of high incidence of cancers. We used to think about the disease of elderly age group. After probably 60 years we used to think that the incidence of cancers are high. But now, no, it's not the scenario now anymore. We are seeing young boys and girls and young women and men suffering with being diagnosed with cancers. When we go into the research, it is seen that we are living in a world full of pollution. It can be either, and we're all eating adulterated food. Our food is not organic, and there are so many endocrine disruptor chemicals. So especially the gynec cancers, if there is a disruption of the hormones, gynec hormone, then there is an increase in the prevalence of the gynec cancers. So the most common thing in this, which we can prevent, all of us today, my first take home message for all of you is to limit the use of plastic. That's the most common endocrine disruptor which we can reduce in our day-to-day activity, which can help us and also our surroundings. So let us take our first take-home message and let us all pledge that we will reduce the usage of plastic. We will not. We will. I think future should be the plastic free world. Especially there is a campaign which we are doing in Hyderabad under the guidance of Dr. Manjula Anagani, where the project is no plastic on private paths. What the sanitary pads we are using also, we have to see whether they are organic or not. Lot of sanitary pads have plastic. So whenever, especially young girls who just started their periods and all, we have to be very careful about the choice of sanitary pads which we are using. And the most important thing is no plastic on private parts. So this is very important first take home message which I want to tell all of you today. And interestingly, endometriosis is a disease of rich. Somehow we look we see more incidence of endometriosis in the urban population, not rich, I say. Sorry for that, but urban community comparatively to the village population. So it is more common in the highly civilized communities, and 50 to 70% children affected women are childless. So these are some hard hitting facts about endometriosis. When you look at the symptoms, the varied symptoms which we need to observe. If any woman, in many women, the progression of disease might be slow. It may develop over many years. So that's the reason sometimes there is a delay in the diagnosis. But the most common symptom, 90% of the women with endometriosis present with severe pelvic pain, especially during periods. This is called also in scientific term, we call it as dysmenorrhea. As a It's called painful menstruation. Apart from that, there is a chronic pelvic pain, vague pain in the pelvis, chronic low back pain, chronic vague abdominal pain and all. And the other most important thing is pain during intercourse. A lot of people ignore this pain when you are having sex. If you are having a severe pain, then probably you have to suspect endometriosis. You have to consult your gynae and get a proper checkup done. Pain during urination or bowel movements, when the endometriosis spreads to the urinary bladder or into your bowel, then especially then you see the symptom, pain during urination or bowel movements, heavy irregular menstrual bleeding. And the most of the people get diagnosed when they come to us for infertility, when they approach us for not having kids, or when they find difficulty conceiving. That's when the most of the endometriosis diagnosis is being made. Bloating, nausea, digestive issues can be mistaken. The most common mistake between endometriosis is irritable bowel syndrome. Lot of people think it as gastric problem, and especially the irritable bowel syndrome. There is also increase in the incidence of irritable bowel syndrome nowadays. And the most common DD, differential diagnosis of endometriosis, is GI symptoms, especially irritable bowel. Fatigue and low energy levels. Obviously, when you have severe period and there is some dragging pain in the pelvis, constantly irritating you, not able to focus, you obviously will have low fatigue, low energy levels, lack of concentration. And also sometimes you may see spotting or bleeding between periods. It's not specifically for endometriosis. It can be seen in other gynec conditions as well. So the most difficult part of it is the diagnosis part. Lot of people, there is a delay in diagnosis. Once there is a delay in diagnosis, the disease is already spread beyond the pelvis. Then it's a very difficult situation to deal with. So on an average, it takes more than 8 years from the first doctor visit for a patient to finally receive a proper diagnosis. See how much delay in the first onset of symptom to the diagnosis. It's a very alarmingly long delay, and this is not care, but definitely we should think it as a harm. So it's very endometriosis mostly is a diagnosis of exclusion. As I told you, a lot of patients think that this is GA problem or some urine infection or some other problem. So there is mostly last diagnosis they come to is endometriosis. And sometimes significant number of women with endometriosis might be asymptomatic. They may present with infertility. Whenever there is a difficulty in conceiving, they may not present with typical symptoms of dysmenorrhea and all, but there's around, probably I can say around 20 to 30% of the patients might present asymptomatically. And why do people delay? One, as today we are here today, because to create awareness. There is a lack of awareness about the symptoms. As the first introduction only, we talk about a bad period. We just ignore our body. We just ignore our body signals, especially women. We multitask. We balance. We do work life balance. We manage the house. But we the most today again, the second message I want to give all of you is listen to your body. Very, very important. If there is a change in the symptomology in your body which is not normal, then definitely you have to approach a doctor. Listen to your body. Your body will definitely give you hints. So the second message I want to tell all of you is, if your body is giving symptoms, don't ignore it. Go and just take an opinion with your local doctor, and that might be a life changing decision. Sometimes a lot of diseases can be picked up early if you approach a doctor early. So the first delay is because of lack of awareness. That's the reason we are here today, to talk about the signs and symptoms of endometriosis, how you can know that you might be one of the one who is suffering with endometriosis. Generally, as I already discussed, symptoms are normally normalized as common period pain, some bad period pain. I might be just having a bad period. So this most commonly we normalize that symptom, especially women. We tend to ignore our own health and try to do work life balance, and doesn't give time to ourselves. And sometimes it can be misdiagnosis. As I told you, we can misdiagnosis for like GA symptom, or some urinary infections, or some other irregular periods. So they might be missing this diagnosis and think about the first other diagnosis. As I told you, the first common diagnosis we think about is GI symptoms. And obviously there is a limited access to specialists. Yeah, but still I think you can approach in a gynae. Definitely should be the one who can diagnose this condition. Cultural taboos around menstrual health. Now I think slightly we have come out of that zone. Previously we used to have a lot of menstrual taboos. Previously, women used to sit outside, not touching anybody, not just not able to show their face. But now I think we have moved ahead of that cultural taboos. Now we are more open up, and we are more, my I can talk with my daughter. My daughter is very vocal, and so now I think the taboos have come down. But still there are some cultural taboos around menstrual health. And and the most important problem, probably, if you think as a woman, I may also may be thinking like that: what if something comes up? What if something has been diagnosed if I go to the doctor? What if? So with that fear, lot of people doesn't go to the hospital. I seen in my own family, my mom saying that no, and now I don't want to go for a body checkup. What if something comes up? It's fine. So it's like fear of finding out. What if something comes up? What if it needs some treatment, some surgery? So so that is something which pulls the patient going to the hospital or getting diagnosed. So when you look at the stages of endometriosis, this is something very critical. So there are four stages of endometriosis: minimal, mild, moderate, and severe. Minimal, very small, shallow lesions with no scar tissue. Mild is more and deeper lesions with early scar tissue. The stage three is multiple deep implants, cyst in the ovaries, and noticeable scar tissue. Extensive, where there, as I told you, there are adhesions between the organs. See, there is one thing which I want to tell you is, symptoms might not sometimes correlate with the stage of the disease. In my practice, I have seen that stage 1 endometriosis complaining of severe dysmenorrhea, whereas the stage 3 might not have at all have any symptom, which is incidentally when they come for pregnancy, I've seen cysts in the ovaries. So So you symptoms might not correlate with the stage of the disease. You should always go with the symptoms. If you are having severe pain, even though there is a minimal disease, you have to be treated for it. So because quality of life is very very important, we should focus on quality of our life and improving our day to day activities or day to day quality of. So this is a, so mostly the visible lesions in the scan will be in the stage 3, where you can see a big endometriotic cyst in the ovary. We call it as ground glass appearance in the cyst of the ovary. So sometimes your symptoms might not correlate with the stage of the disease. As I told you, endometriosis lesions have been found on every major organ of the body from the ovary, but the nearest organs are definitely the ovary, fallopian tubes, bowels, bladder, and all. We have seen cases reported in, as I told you, in brain, heart, kidney, lungs, liver, appendix, so all parts. There are so many case reports which have been presented recently where endometriosis is seen in all parts of the body, which again tells the importance of the disease and early intervention in the disease. As we have discussed earlier, can endometriosis be cured? No, probably can be managed. It is a chronic condition. It is the American Society of Reproductive Medicine clearly stated that endometriosis should be viewed as a chronic disease that requires a long, lifelong management plan. It doesn't end on 1 or 2 days. It requires a lifelong management plan with the goal of maximizing the use of medical treatment and avoiding repeated surgical procedures. No single treatment is ideal for all patients. Management should be chosen depending on individual needs of each patient. Suppose if you're planning, what does it mean? If you're planning pregnancy, my focus will be more to plan pregnancy first rather than surgery. But if your symptom is pain, severe pain, then surgical option will come first. So medical management will come first. So these are the, so it depends on the individual needs of each patient. Combination therapy may be ideal as it's a chronic disease. We should combine not only efficacy but also you have to look for the long term safety and the tolerability of treatment options. Now there are so many medical managements which have come up. They are hormonal pills. There is Mirena, the intrauterine contraceptive progesterone device, which is very effective method of managing endometriosis. There are new drugs like uh, Ecolics, Elagolics, and new drugs which have come into the market recently, which can effectively manage the pain of endometriosis. So, long term treatment is required, repeated courses are required depending on the severity of the disease. As we have discussed about the pain of endometriosis, there is some 8 types of pain which you can think of. Severe dysmenorrhea, like painful periods, lesions bleed and swell with each cycle, irritating. How? Why there is a severe bleeding, pain? Because of the irritation, or wherever their nerves are irritated, the pain will be there. So pain is because of the irritation of the peritoneal nerves. Sometimes that adhesions, which because of the adhesions occurs and the organs will get matted with each other. Pain often starts days before bleeding, radiates to the back on the thighs, and may come with nausea, diarrhea. A lot of people who have period pain, severe dysmenorrhea, want to go to poop or go to potty for multiple times. It gives a sensation of heaviness because it is a cyclical and progressive. Many women lose school, work, and social life every month, even when scan looks normal. Dyspareunia, it's a scientific term where we call when there is a pain with sex, we call it as dyspareunia. Deep or sharp pain during or after intercourse can occur in endometriosis, especially lesions located behind the uterus may be stretched and compressed when you have a deep penetration. Sexual pain is often minimized or dismissed out by generally by the patients. Painful bowel movements, endometriosis, whenever there is involvement of the bowel, can cause pain during bowel movements, which may feel as if passing broken glass. It's so painful bowel movements. Women with endometriosis may avoid using the toilet around their period. Bowel endometriosis is frequently mistaken for irritable bowel syndrome. As we have already talked about, just bad cramps might not be, no, it might not be just bad cramps, it can be endometriosis. We should always have it on the back of our mind. As I told you, if there is an involvement of the bladder, generally there will be pain during urination. Generally, we misdiagnose it as urinary tract infection. And whenever there is an inflammation in the pelvic region, whenever there is a pelvic nerves are involved, there is an electric burning, shooting pain uh, behind the backs and the thighs. And you sometimes see, as I told you, you feel weight in your back and hips. When it spreads to the lungs or heart, you can see like the heart attack like pain in your chest or shoulder can be seen. So these are the some types of pain you observe in endometriosis. Cheat sheet for endo symptoms. Sometimes the foods to support if you have bloating. These are the foods you can eat. Dragon fruit, ginger tea will help. A lot of people drink ginger tea. And if you fatigue, eggs, seafood, you all know this, vitamin rich food, pain, turmeric, salmons will help inflammation. All of you, I think, might be hearing about anti-inflammatory diet. It has become so popular nowadays, where there are a lot of berries, blueberries, flax seeds, walnuts, seafood, green tea, chia seeds. All these are anti-inflammatory diet. Poor poor sleep, hot cocoa drink, high histamine, blueberries. Uh, if your stool is not good, legumes, apple, wherever you have to eat good amount of fiber. To estrogen dominance, broccoli, veggies, coconut water. Fertility support, now avocado has become such a well-known food, but I think there is no need to eat fancy fruits. The guava is good, almond seeds, chickpeas, seafood, all these things can help can help a bit along with the medication to maintain your endo symptoms. So when you look at the myths versus reality in endometriosis, a lot of people think that endometriosis is just a painful period. It might not be. It is a long chronic inflammatory disease that can end up in severe pain and infertility, and in severe cases can involve the vital organs of the body. Generally, we think that endometriosis affects only one subset of women, like around 30 to 40, but now that boundaries are not anymore. We are seeing in as early as 10 to 12 years to in the menopausal women as well. A lot of people think that it is a disease of reproductive system. No, we are seeing endometriosis in brain also. So it's almost every part of the body. And the most common thing, a lot of people think that whenever a lot of people think whenever you don't get your period, endometriosis is cured. No, pregnancy, especially they think pregnancy is considered as a cure for endometriosis. Yes, whenever you don't get your period, the symptoms might reduce, but it's not a complete cure for endometriosis. Birth control pills and other hormones will stop the growth of endometriosis. They may not stop that, but they can slow down the disease progression. Hysterectomy and removal of ovaries believed to be the cure, but now after removing the uterus and ovaries also, we are seeing some patients with the symptoms, but the incidence is definitely on the slightly on the lower side. Endometriosis affect upper socioeconomic women or career women. Now it's not anymore. We are seeing in all socioeconomic groups and all occupations. Taken seriously only when linked to for infertility, not linked to pain, illness, or cancer risk. See, that's a problem. Patients come to us because they want to conceive. Otherwise, they ignore all these symptoms, which is affecting their quality of life. Endometriosis slightly has an increased risk of ovarian cancer as well, but not probably around a 2 to 5%. So it's very important to look at in a holistic way, not only for conception, for improving our quality of life and to prevent further complications in the future.
There is a question asked by Meghna Francis. I have consumed flax seeds, but I was experiencing pain coming back, as I had no pain earlier as flax seeds estrogen.
Okay, so there's some background noise here. A bit of prayer is going on. So basically, what I understood is before flaxseed there is no pain. After using flaxseed there is a pain, right? Is that her question?
Meghna, can you answer on chat, please?
I
Yes,
have
that's it.
consumed. No,
Yes,
I'll go to the.
yes.
I have consumed flaxseed, but I was experiencing pain coming back as I had no pain earlier. Flaxseeds influence estrogen. Okay, okay. So basically, see, Meghna, I don't think flax seeds will be the only reason which can increase the estrogen and cause the pain. So, so I may not definitely see diet is only one of the integral part of this mecha. If you're getting pain, that doesn't mean that because of flax seeds you are getting a pain. There might be some hidden reason or some some triggering factor which is causing pain. So I think you need to go and consult a doctor if the pain is unbearable. But as such, flax seeds doesn't increase the incidence of your period pain or pelvic pain, right? So it doesn't definitely how much you are taking it. Hardly we take a probably a handful of flax seeds. You shouldn't do that, right? So if it is pain is there, that means there might be some other triggering factor which you need to be evaluated, right?
Okay. I think there is one question.
Yeah.
Uh, Rayan has one question. As you had said, girls should come in contact with less plastic. Which sanitary pads would you consider safe?
See, whatever sanitary pads you are using, you have to see the composition, what it is made of. Nuva is one sanitary pad which is very good. So, which is not having plastic. You can try that brand. Uh, whichever pad or whichever company you're buying it, you have to look into the plastic composition of the pad, right?
The further question to this is: are tampons safe?
See, it's very difficult to keep a tampons, right? It is very cumbersome. Previously, again, during the sometime menstrual cup has also came up very became very this thing nowadays. But it is very cumbersome to maintain a menstrual cup or tampon. Instead, menstrual cup is a much better option than tampon.
Right.
Yeah, somebody's asking, are menstrual cups safe? Yes, yes, definitely. But you need to sterilize it, keep it in a proper place, keep it very hygienically. Then definitely it's a very good option, very safe option. If you're comfortable with it. Is I will only is there a time limit for consuming pills? Like how long can anyone consume pills? What do you mean by pills? The contraceptive pills or the hormone pills for the pain? Basically, as see, when you think about the management of endometriosis, treatment of endometriosis, there are medical management, there's surgical management, and and in the medical management, there are tablets, which are pills and hormonal pills, and you have IUCD, intrauterine device IUDs, in which Marina, where the drug is incorporated in the IUD and you keep it in the uterus, which is again a very safe option. So basically, the studies are there till 5 years. So you can use the drugs on and off with a break period, so maximum of 5 years. And this IUD, intrauterine device, is a very safe option which you can use. And there are also some pills which can be kept for longer period.
Yeah. There's another question: can endometriosis be diagnosed and brain endometriosis or in any other organ? Can we diagnose that?
Yeah, see, especially as I told you, the most common site is ovaries. Ovaries are the prime organ where the endometriotic implants go and settle. It can be easily diagnosed by simple ultrasound. And the other way of diagnosing endometriosis is whenever we are looking for people with infertility or couples with infertility, when we do a laparoscopy, sometimes incidentally we find endometriosis in the peritoneum or in so this intestines, bladder endometriosis all can be diagnosed, but the brain endometriosis or lung or heart, it's a very very rare diagnosis. It's not a common diagnosis, hardly. It's like 1 in 1 lakh or something, so it needs a very strong sense of suspicion. It's a diagnosis of exclusion. You don't keep a first diagnosis is brain endometriosis, right? It needs a very strong suspicion. There are only few case reports which have been mentioned, but that's a very rare diagnosis. So after ruling out all other possible causes of brain probably causes, then the last diagnosis comes to endometriosis. But all the other organs like bowel, bladder, ovarian, all these endometriosis can be diagnosed by ultrasound and when you're doing a laparoscopy. Uh,
Okay.
someone seems, yeah.
Yeah, Meghna asks, since endometriosis reduces egg quality, can diet be helpful? Or what should be the
Yeah,
appropriate diet?
definitely. See, in IVF, I do lots of IVF every month. So when you take a patient with endometriosis, without endometriosis, with the same sperm and egg parameters, definitely a woman with endometriosis will have poor egg quality, poor embryo quality, and also the uterus. There can be adenomyosis associated with endometriosis. Yes, definitely same parameters compared with women with endometriosis, without endometriosis. Yes, definitely it is a known fact. So yes, food definitely will help you. It doesn't do like miracles, but definitely, as I shown you the cheat sheet, which there are walnuts, almonds, berries, anti-inflammation. All these are anti-inflammatory diet. These will definitely help you to reduce the inflammation. Yeah, it will definitely aid in the, or it can just help in the treatment process. Yes, definitely diet.
Okay. Yeah, thank you, doctor, for answering that. Another question by Sasikala is, so what is the treatment for endometriosis? Just painkillers.
No, 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 no. Now, just now we have discussed multiple options, right? Painkillers, we don't give painkillers is for the temporary relief. They're like acute conditions where the pain is severe. So, but you can't take painkillers for a longer period of time, right? See, basically, endometriosis is a because of the estrogenic condition, hyperestrogenic condition. So we have to reduce the levels of estrogen. For that, there's a drug called progesterone, which we give in endometriosis. They are hormonal pills which can control this disease progression and suppress the menstrual period. There are some like GnRS suppressive drugs, and as I told you, there is intrauterine devices which can suppress. There is a new drug which has come, which is called GnRH antagonist, which suppress the pathway and prevent the periods to come. And there is a surgical option also. It's not that there is only medical option. So there are multiple options. We have to see each and every patient depending on the requirement, depending on the stage of the disease. We have to plan the treatment, and also whether they're planning conception or not. That also we have to take into consideration, because when you're planning conception, you need the menstrual periods, you need ovulation and all. But when you're not planning, then that management will be different. So we each and every patient we have to individualize and plan the treatment option. No, not only painkiller. There's so many options available now.
Okay. Another question, I think by Pavani. It's been 6 months of my marriage and I have a lot of pain during intimacy.
Okay.
Yeah.
See that then you have to just s- go for a local examination with a gynae. It might not be endometriosis. It can be sometimes, see, during the first few months of the marriage. Sometimes it can be a painful intercourse because of your tight vagina or some other reason, or some, most commonly you might earlier days of the marriage there is a risk of urinary tract infections. All these things might not be typically endometriosis in your case. It's always better go for a gynec examination. Your gynec will see, or see, do an internal examination and then guide you mostly. So early
Okay.
months of the marriage, it's relatively common thing, but
Yeah.
still
Okay.
you need to go and consult your gynae.
Yeah. Sheila asks, I have a Marina loop inserted for 10 years now. The periods are very irregular, almost nil, but the nagging pain still continues with intervals. Is it okay to take mild painkillers like Meftal Espas? Also, the quality of life has improved and intensity has reduced after the Marina.
Yeah, as I told you, Marina is one of the best option because it can be kept for a longer period. Pills we have to take every day. Sometimes we get vexed up with taking pills and all. Marina is a very good long-term option. As I told you, it can reduce the symptoms sometime, but still it is if the pain, mild pain, yes, temporarily you can take Meftal, nothing harm in taking. Yeah, but I definitely you yourself have mentioned that your quality of life has improved with Marina and intensity reduced, which is very good to hear.
Okay, another question is, may I know the difference between endometriosis and adenomyosis?
Yeah, definitely. See, endometriosis now, as I have discussed, the menstrual blood, the endometrium goes back and get deposited in the ovaries, pelvis, and in severe cases, bladder, bowel, and all. Adenomyosis is it's going back into the uterus only. That means see, I can show you the picture here. See, basically, the endometrium will go from the tube and get deposited in the ovary in endometriosis. But adenomyosis, it goes into the myometrium, the wall of the uterus, and the wall becomes very thick. That is called bulky uterus. The uterus become bulky. It is going back into the myometrium and getting deposited and becomes bulky. So the most common it becomes like a globe. The uterus becomes like a globe. That is called adenomyosis. It is also causes severe pain. The mostly seen in slightly elderly age group.
Okay, there is another question. My daughter is 18 years. Since few months, she is having a painful period with clots. Have done ultrasound. The report is normal.
Okay, painful period with clots. Have done
Yeah.
ultrasound report is normal. I think nothing to worry. Sometimes because of there is a see sometimes because of the stress. Sometimes see our food, stress, our weight, everything affects our period. So if there is an increase in the weight, or she gained some weight recently, or there is a stress or exams are going on, sometimes they present with this painful periods and all, but temporarily you can take some medications which can relieve her period pain with heavy bleeding. But otherwise, if her ultrasound report is normal, nothing to worry for that age.
Okay. Is endometriosis triggered by stress? If yes, how does it affect nervous system? Also, do we suffer nausea?
Yeah, as I told you, definitely stress is one of the triggering factor for any chronic inflammation in our body. Yes, it causes inflammation. Stress is what? Stress is response given by our body to a situation or where you feel so that's how the body reacts. So definitely stress will be endometriosis or any other chronic condition is triggered by stress. Yes, does it also affect nervous system also? See, not in all cases, but definitely when you have a severe period pain, nausea is one of the things which we have in general. When the pain is severe, obviously, as I told you, pain is because of the irritation of the nerves. When the nerves get irritated, you feel that pain, right? So sometimes you may suffer nausea as well. Kameshwari Satish.
Okay.
I
Yeah.
have, yeah.
I have taken infertility treatment almost 18 years back, still facing a lot of hormonal related issues. I am 51 years old now.
See, probably I don't know what hormone related problems exactly symptoms you're having. Probably you being 51 years old, probably it is something menopausal symptoms which you are experiencing. So better consult your gynae. She may give you some hormone replacement therapy if your symptoms are more.
Okay. We have another question. How does a girl who just entered into a menarche know it's a regular period pain or endometriosis? Are there tests that teenagers can undertake?
No, no, no. See, the thing is, girls who just entered into MENAR for the HPO is the hypothalamo pituitary ovarian axis. To settle that axis, it may take 2 to 3 years for the girls who had menarche. It takes 2 to 3 years for the HPO axis to settle down. So, we can't intervene or we can't give medications at that point. So, if we give we or we intervene at that point, we are disrupting the HPO axis, which may later lead to other problems in the future. So, if the pain is very severe or something, we can just manage with some anti-analgesics or something if it is very severe pain. Otherwise, the initial few years after menarche, the cycles are slightly irregular with pain.
Okay, I'll just take one more question.
Yes.
So, Preeti Shah asks, hello doctor, I used to take Meftal Espas too, but now many doctors are saying not to take Meftal. Any reason why? Also, please suggest an alternative mild painkiller.
See, any painkillers, we can't take it for a longer period. These are only for a temporary relief, not for a long term management. Yes, when you take a long term painkiller, sometimes they may have an effect on our kidney function. So there are a lot of doctors advise not to take more painkillers. The mild painkiller or the alternate is definitely paracetamol.
Okay. Last question. K. Sarvanthi is asking about endometriosis can affect endometrium and tell me about thin endometrium.
Thin endometrium itself is a very vast topic to be discussed, but I understood your question. You meant that if you have endometriosis, you will have thin endometrium problems also. So yes, endometriosis is something which goes hand in hand with adenomyosis. Yes, it sometimes affect the endometrium as well, where in people there will be difficulty in conceiving. Yes, sometimes we see those patients. We have to treat accordingly.
Okay. Thank you, doctor, for for answering these questions patiently.
Yeah,
Um,
thank you,
yeah.
Nisha.
To everyone who joined in today, thank you for taking
Thank you,
this.
everyone.
Yeah, thank you for joining. Thank you for taking this step towards awareness. If there's one message we want you to carry after this, is pain is not normal and support is always available. At Aarsh ReproHealth, we remain committed to being a trusted companion on your reproductive health journey with expert guidance, a supportive community, and care that feels personal. Uh, Yeah, you can find the link for our platform in the chat box itself. If you have more questions, need consultations, or want to explore resources, you can visit our platform at www.arshreprohealth.com. Thank you once again for everyone for being here, and we hope to see you in our next session, which we will announce soon. Have a wonderful day ahead. Thank you everyone who are writing in the chat as well. Yeah. Thank you, doctor. Thanks a lot.
Thank you. Thank you so
Thank
much.
you.
Thank you,
Thank you,
everyone.
Doctor. On behalf of Aarsh Reprohealth, thank you so much for being a part of this wonderful session.